Good afternoon. We'd like to welcome you to the ninth webinar sponsored by the Healthy Flint Research Coordinating Centers today, May 15th. We're so delighted that you've decided to tune in today for this webinar. We've got great information we're going to share with you today. My name is Yvonne Lewis. I will be your moderator for today, and we have some extremely extraordinary information that I know you're going to be that will benefit the work that you're doing. I'm one of the co-directors of the Healthy Flint Research Coordinating Center, which is a collaborative of partners from the community, the University of Michigan, Flint and Ann Arbor, as well as Michigan State University. Been tremendous partnership that started in 2016. For those of you who have joined us for the first time, and we want you to know that we are happy that you're here today. And just as a few quick tips, we have a wonderful team of partners that have been with us from the very beginning of this webinar, and we've had it some over the last few weeks. The list of partners that you see today are also available to answer any questions that you might have. It has been very, very important for us as community partners to ensure that we were aware of the services and programs that were available to us right now during this COVID crisis. We call it a crisis, it's a pandemic, but right here in our community, there are some things that we knew our community partners were working on, but we wanted to make sure that you knew them as well, because those of you that are outreach workers, navigators, you're helping us to make sure all of our communities are aware of the programs and services that are available. At the bottom of your screen, you'll notice that there's a Q&A button. We want to encourage you as we're going through the webinar today that you click that button and put your questions in, because we'll be wanting to make sure we answer any questions that may arise as a result of our discussion today. You may have questions from previous webinars. Please feel free to put those in based upon the partners that are here today to answer those questions for you. We do have some special guests. We call them special guests because this is their first time joining us today. And we gave you a little teaser last week. We told you that we would have a representative from Metro Community Development, but you know we're working in real time and things are happening. So our representative Tracy Jackson told us that she had a conflict for today, but I want you to stay tuned. Next week, she will be here. There's a group, the Continuum of Care, that's looking at issues that affect those special and vulnerable populations in our community, that we want you to know that some things are being planned to make sure that they're taken care of today as well. We will have, in just a couple of minutes, we're going to hear from Kyle McCree, who is from Consumer Energies, and we're going to talk about some energy savings. We want to again acknowledge and appreciate all of you that continue to share with us how this webinar is benefiting you. Keep those questions coming in. Keep us updated on what you're learning from the webinar so that we can do an even better job going forward in the future. Again, our goal is to bring to you a local context of this global situation, and then make sure that we're helping our community members be able to make some informed decisions based upon the things that are particular to the Flint, Genesee County communities. So today, we're going to focus in on energy savings, and we're going to be talking with Kyle McCree. He's a Community Affairs Area Manager for Consumers Energy. So welcome, Kyle.
Thank you, Yvonne, and thank you to all the partners for the Healthy Flint Research Coordinating Center. It's grateful to be here and happy to join you today.
Well, Kyle, will you first just help us to understand what your role is for Consumers Energy? What does it mean to be the Community Affairs Area Manager?
Yeah, so one way to think of our role, if you think about it as a farmer, community affairs, we view ourselves as the people who cultivate relationships, both within the company and within the community for the benefit of both the company and the community. So I see a number of friends and colleagues on the call today, and if they knew of someone in the community that had a question, had a concern, well, certainly our website, our 800 numbers are always available. It's good to have a local face, a local person that you can reach out to. Also serve a role as, in some ways, the eyes, ears, and locally voice and face of the company here in our community. So we have over 400 employees that work in Flint and over 7,000 around the state. And I'm embedded in the community as an advocate and as an ally to help our community move forward, because that's how we win as a company when Michigan wins.
Thank you, Kyle. Now, there are three important things that you want to address for us today. And so they're regarding energy savings. So you're going to share with us some tips for residential customers, something really exciting I think you want to tell us about for small businesses, and then other updates from consumer energy. So please help us to understand what we can do to save.
Yeah, so we know that we are in a unique situation, and this is in the last 100 years, not something that we face, although as a company we were around 100 years ago, but we don't have the best records on how we faced the pandemic of 1819 as a utility, but we're moving forward and trying to do the best we can under our current situation. For our residential customers, if there are a few things to note. One, if you have any questions, this is actually for residential or business customer, the website to go to is consumersenergy.com/coronavirus. It's linked to from our homepage, but if you go to just /coronavirus, the information I'm going to talk about is all listed there. But first, for residential customers, we know that there is not a single solution for every customer. We have taken steps from the beginning of the pandemic. We have customers who are qualified low income or seniors. They are already on sometimes winter protection plans that normally end in April. We've already extended those protections out through June 1st. We've also suspended shutoffs for low-income and senior customers through June 1st. But for every customer, whether they're qualified low-income, senior, on a program, not on a program, we really are asking them to reach out to us. Please be proactive. You don't have to wait until you get a bill that you can't pay when you think you're going to have a bill that may be an issue for you. Please call us. We want to work with our customers. The number to call for residential customers is 800-477-5050. It's the same number that's on your bill. Call that number. Our customer service representatives are empowered to help our customers through this trying time. We know that what help you may need is different from your neighbor, different from someone across town. And so that's why there's not a cookie cutter approach. It really is customized to what our customers need. There are a number of assistance programs available through our company and also through 211. But we also have things that, people may need payment arrangements made because of loss of income. We want to work with their customers. So we're really asking them to call us at 800-477-5050. Also on our website, and just from things that you may know as you get the flyers that you sometimes pitch in the trash, things that you can do to reduce your energy usage. That's being mindful of, do it today when it's a little bit cloudy, you have a light on in your office as you're working, but the last few days when it's been bright and sunny, you can turn a light off and save some energy that way. There's things that we can all do if you want to reduce your energy usage that then reduces your bill. But we do definitely encourage all of our customers to reach out to us and to call the 800 number. I'm going to say it again, 800-477-5050. Please pass that along to people you know in your lives, your loved ones, your friends and family. Please have them reach out to us proactively and let us help them out through this difficult time. For our business customers, the advice is somewhat similar, but the phone number is different. That's probably the biggest thing. Business customers are unique. They have different needs than our residential customers. And so we have a separate line for them. We have a business center we've always had. And that number is 800-805-0490. You can also find that number at consumersenergy.com/coronavirus or consumersenergy.com/business. For our business customers, we know that payment arrangements are very important, as our business customers oftentimes may not be in operation right now. And this is both for-profit and nonprofit businesses. So whether you're a factory or a church or anything in between, we want to work with our business customers. We want to find arrangements that may work for you. Also for business customers, we've always had programs for businesses and residential customers. We have energy advisors come out to your house, they walk through, come out to your business, walk through, tell you change this, increase this, put a different light bulb in here, reduce your energy savings. Well, we can't do that now because of social distancing. We have to work safely, both for our employees and our customers. So for business customers, we have developed a virtual energy coach. And you can find this email at consumersenergy.com/business. but I'll give it to you as well. It's small business assessment at consumersenergy.com. Small business assessment at consumersenergy.com. Small business assessment at cmsenergy.com. Excuse me. That's why I give you the website in case I mess up on the email. If you email us, we'll have a virtual energy coach, so it can be through FaceTime or Zoom, where we'll walk through your business with you, help you reduce your load. But any business customer can do this on your own in some ways. If you're not an operation or you're a reduced operation, do a walkthrough. If you have a plant manager or a trustee chair, if it's a church, do a walkthrough and look at how you can reduce your load currently. And definitely call us as you need assistance for business customers at the 800-805-0490. Also on our website, we have programs we've always had, but we're continuing to push them for people if you want to become a supplier of Consumers Energy. One way to help pay your energy bill is to have us as a customer. And we love doing that. We are a big proponent of buying from Michigan-based customers, small businesses in particular. And you can find that on our website if you click the company banner on our homepage. Finally, and this is going to tie it to small business and recent grant announcements, you may have seen last week, the Consumers Energy Foundation, which I do want to note is a separate entity from our company. It's our charitable arm funded by our shareholders. Announced $1.8 million in grants to entities across the state for small business grants. 200,000 of that was granted to the Flint Genesee Chamber Foundation here in our community, and that is funding small business grants, and you can apply for that at the Chamber website, which is flintandgenesee.org, and you'll see the Restart Flint and Genesee program. There was another announcement from the C.S. Mott Foundation earlier this week for additional funding for Flint African-American businesses, but our program is, the dollars that we granted, our $200,000 is available to any Genesee County small business. And the Chamber has a variety of criteria, and there's an application for both programs on the Chamber website. We have done other grants on top of that, totaling over $3 million from our foundation to food banks, to United Ways, community foundations, MSU Extension for some development work for PPE for frontline workers, and of course the small business grants that I mentioned. So we're here for our customers. We've been here for our customers for a long time. We want to continue to be that way. It is really important though that we hear from our customers, because we don't necessarily know the situation that you're going through. We need you to reach out to us. I will say also that we have record low wait times on our call lines, both for businesses and for customers. Our call center folks are all working from home. So please do reach out to us. And I'm going to say it one more time, consumersenergy.com/coronavirus. And residential customers should call 800-477-5050. And business customers should call 800-805-0490. I'd be happy at the appropriate time to take questions, and I want to thank Yvonne and your team for all your work to set this up.
Well, thank you, Kyle. And I do have a couple questions. Emphasize that don't wait.
Yes.
I really appreciate that. I know sometimes in his past, people have said, well, don't come until you get a shut-off notice. But you're saying don't wait. So can you just emphasize that a little bit?
Yeah, and there are some assistance programs, particularly through the state, that may require a shut-off notice. But we're asking our customers to call us proactively. There are things that we may be able to do that don't require some of those assistance programs, or there are other programs that, because of this situation, we're in a unique environment and there's unique rules. We have received additional federal dollars for heating assistance that came through in one of the first stimulus packages from DC. We're continuing to push for more assistance for our customers from the federal resources, but we really want our customers to call us. We know every situation is different. We've done this in the past. It oftentimes has not been as public. When we had, here in our community, when we had the GM strike a few months ago, it was the same advice. We didn't have a program for GM workers who weren't working, but it was call us. We understand what's going on. we're going to work with you through the situation. And the same is true today through the pandemic that we're going through.
Well, thank you. So again, we want to encourage all of those that are participating. If you, whatever networks you have, we know we don't have 50,000 people on the call today. So we do want to use our networks to get this word out. One other thing that came up. Now you talked about the nice weather, opening up your windows and so forth. And so some of us have actually turned our furnaces off. And some information was shared with me that wasn't the smartest thing to do. Is like to turn it down, but don't turn it off because it works your appliance too hard. So not quite the energy savings we thought because it could destroy your furnace life. So can you talk about that a little bit?
Well, I am certainly not an HVAC person, and I see some friends who know me very well that will attest to that. But you want to operate within the guidelines of your appliances. And frankly, in the last couple of nights, as it's gotten pretty cold, you may have wanted the heat on a little bit. But you can reduce your energy load. You can see I'm wearing a pullover in the house, so I don't have to have the heat on as high right now, even as I'm working from home. But yeah, turning off appliances can be different than shedding load through reducing the temperature that the appliance turns on at. Not right now, this time of the weather, but as we get in the winter, also turning off your furnace can be really bad for your pipes as well. So you do want to have a minimum level of temperature in your basement in particular.
So just a little tip, it is an energy savings. So we don't want to try to save too much on the front end and then lose it all on the back end. So
yeah, same thing for business customers. You know, you may not want to unplug everything because you could have critical infrastructure, your HVAC and whatnot, that does need some power, and you don't want to have issues when it is time to come back to regular operations.
So thank you, Kyle. Just as a reminder, please give Consumers Energy a call. Those numbers we will make available in our notes for those of you that follow. We'll give some updates to our webinar when it's posted. So thank you, Kyle. We're excited to have with us today Gary Jones. Gary Jones, we're going to talk a little bit about what's happening. We really touched on this very briefly last week, but Gary Jones is the Community Affairs Representative for Flint out of the Office of the Governor. So Gary, just again, would you help our community members? They saw your face a couple weeks ago, but tell us what it means to be the community affairs and how your work fits in with what we can know about here in Flint.
Yeah, thank you, Yvonne. And I was about to say, but it's actually afternoon now, so good afternoon, everybody. Yes, Community Affairs is a department inside of the Executive Office of the Governor. It essentially serves as a liaison function in between communities and the governor's office, but also to the various state departments too as well, the 18 state departments. So my job is just basically, providing like needed information and resources, especially, now given like the COVID-19, reality, and things are happening so rapidly on a day-to-day basis, and just being responsive, to the questions, that are coming in. I mastered this whole art of multitasking thing, being on like 2 or 3 calls sometimes at the same time. But my goal is to make sure people got updated and accurate information, guidance, resources, but also any feedback as well, that comes from community, making sure it gets connected with the government office or with appropriate departments in the state.
So thank you, Gary. One of the things I know you do well is you send out emails every day, 2, 3 sometimes a day, of what's happening out of the governor's office. And so you've been giving us updates on the number of deaths and the number of tests that have tested positive. And we noticed the other day, we're also starting to talk about the number of individuals who have overcome the virus. So that was really good. But one of the important things we've been talking about lately is this reopening of the state. We talked about the executive order a little bit last week, and we wanted to talk about that a little bit more today. So you can give us some insights from your perspective. So when we're talking about that executive order, we know that there's a process to that. So can you talk to us about the executive order of the governor's office?
Mm-hmm. Yep, sure thing. Oh,
next slide, please.
Okay, yep. So last week, the governor announced the that Michigan manufacturing workers will return to work on this past Monday, actually, the 11th. And in addition to that announcement, she also detailed the 6 phases of her Michigan or My Safe Start plan to re-engage the economy. The governor's been working with leaders in healthcare, business, labor, and education in order to develop. And the announcement last week basically states that Michigan is in the 3rd phase, or the flattening stage. She's been working closely with healthcare experts and epidemiologists to closely monitor Michigan's progress in the fight against COVID-19. So when you hear the governor typically speak in terms of like monitoring Michigan's process, she typically refers to a dial situation. And not necessarily a switch, but things are going to be re-engaged as on or off. But in some instances, we may have to, cut dial up in a particular, say, industry like manufacturing, is one that has returned. And then there's going to be a monitoring, period, obviously, to determine, the rate of spread or we want to continue to make sure that curve continues to go down in terms of positive cases and deaths. So there may be a situation where we may need to turn the dial back if we're seeing, what starts to look like a second wave, because that's something that nobody wants to experience. So as we move forward, with the My Safe Start plan, we're going to continue to work closely with partners in business, labor, and education in order to determine the best way each and every day that we should be progressing. We've already, like I mentioned, opened up certain sectors like manufacturing, lawn care, and construction. But again, the worst thing that we can do is open up in a way that's going to cause a second wave of infections and deaths. We don't want to put, our healthcare workers at any further risk. And, we don't want to wipe out the progress that we've already made as a state either. So we're going to continue to monitor, the spread of the virus, hospital capacity, testing rates, and more as we work toward reaching the next phase, which is the improving phase that you got up there.
Okay, so this is we're in that improving stage, or we're working toward that, but we do want our community to know they can go on the website and look at this in more detail. But this is just giving a sense of the steps that the phases that the governor is using to determine how we will open our community. I know that was a great concern for many of us because we don't want to be in a situation where we're creating more problems for ourselves than we're helping. So thank you, Gary, for that. It really helps us to segue into the next part of our conversation, because in order to improve the cases, I think I need to, just one more tip, Gary, before we switch. You were right, Tricia, that we wanted to just make sure that we let our community members know, for those that are experiencing challenges with their ability to pay their bills, this executive order was also put in place by the governor to ensure that people don't lose their homes. So this line is still available. This website is still available for people to contact in the event they have some concerns about potential eviction. So we just want to make sure we included that. Is there anything else you'd like to add to that, Gary?
Oh, the only 2 things that I will add, and you alluded to it earlier, is that there is a document, the My Safe Start plan. That's the 15-page document actually that gives more detail, and I can definitely make sure that I share that with you too, Yvonne, so you can push it out to the group. I just did my best to just try to summarize 15 pages over this. But then also too as well, just pertaining to that evictions order that you just put up, this is an extension of a previous executive order, and this one is currently extended until July 11th.
Awesome. And I think that's important when people are losing their jobs, and then some are not sure at what point they will go back. But this is really important. The other thing we want to remind us, don't wait to the last minute. Get some questions answered early on. I want to remind our listeners that there is a Q&A button at the bottom. Kyle is still on. Gary will be here. If you want to ask some more specific questions, please go to that Q&A button and answer those questions. So as we're talking about these shifts that we're seeing, and really want to make sure that we're watching what's happening. This whole issue of testing, I'm so happy, Suzanne Cooper, we've known each other for years, from Suzanne's worked at the health department for years, but this work has really taken on an extra load for her. And she's been out all over the place trying to make sure that what we need here in our community is available to us through testing. So the health department has really been working diligently to identify places for testing. So Suzanne, can you bring us up to date? We've been talking about this, and there are more and more sites coming on. And so we want to talk about the updates for the testing sites. Suzanne, can you unmute yourself? Suzanne Cupo. There you go.
Can you hear me now, Yvonne?
I can hear you now. I could just feel you were talking. I can hear you now.
Yeah, good. Just want to make sure that we start with an update on our current testing numbers. So we have 1,812 positive COVID-19 test results in Genesee County, with 227 deaths. And a reminder that this is not reflective of all the potential COVID-19 cases that have been in Genesee County since the beginning of this pandemic. It is reflective of those that have been tested. So testing is critically important, and we want to make sure that we are adding testing locations that are in neighborhoods that are accessible to as many people as possible, to make sure that we have no disparities in who can get tested and who cannot. So just a reminder that the priority for testing right now is symptomatic individuals and asymptomatic essential workers. And we continue to identify testing locations in our community, and we'll have some new ones to announce fairly shortly. But I did want to let you all know that we are working in partnership. So the Genesee County Health Department, the City of Flint, Michigan Department of Health and Human Services, the Genesee County Emergency Manager's Office, and the state of Michigan, including now the Michigan State Police, are all working together in order to make sure we have access to these testing locations in Genesee County. So I'm really happy to announce a new testing location that has started today. It is at the Walmart on Corona Road in Flint Township. They are going to be open Monday, Wednesday, and Friday from 7 a.m. to 9 a.m. Again, some non-traditional hours to allow for more people who work to be tested. Their screening process and appointment process is via their website, www.myquestcovidtest.com. So that is on the screen. And they do have a number to call, 866-448-7719. So this is the latest location coming on board today. We also have at Grand Blanc High School's parking area a site that is run by Kroger, and that site is open Monday through Thursday, 10 a.m. to 4 p.m. And again, the screening process is through the website. We also have another pharmacy providing support in our community, and they have two locations. Rite Aid is at Swartz Creek, and they are open daily from 9 a.m. to 5 p.m. And last week they opened the site that is at 5018 Clio Road in Flint. And they are open again, non-traditional hours, Monday through Friday, 10 a.m. to 8 p.m. to accommodate for those who have to work. And they are open on the weekends, again, from 9 to 5. Michigan Health Specialists continue to offer testing by appointment Monday through Friday from 9 a.m. to 5 p.m. at two locations, 2065 South Center Road in Burton and 2700 Robert T. Longway in Flint. So those sites continue to be open, and We want to remind everyone that Genesee Health Systems is also doing testing. They're doing mobile testing that is not open to the public, but they are providing services to group homes, assisted living facilities, our shelters, and those substance abuse treatment centers in our community. So they've been very busy working in those locations, trying to make sure that all of those facilities are taken care of. And as you all know, we partner with Hamilton Community Health Network clinics. They have their North Point clinic and their Burton clinic available on Tuesdays and Thursdays by appointment. And you see the information on the screen. They have been a great partner and continue to offer service in our community. We will be back with some additional information about other testing locations in the future, but I want to make sure that you know that the Rite Aid and the Kroger locations are doing everything by appointment, but they are not requiring a doctor's note.
Suzanne, could you go back and talk about the Walmart Supercenter one more time? You said non-traditional times. They're going to open early at 7 a.m. and they're staying open until 9 p.m.?
9 a.m. So they're a 2-hour window at that site.
Okay.
And they are open again 7 a.m. to 9 a.m. Monday, Wednesday, and Friday.
Okay. So for those early birds and get in there, especially those essential workers. And I know we've talked about this too. Essential workers are not just the persons that work in the hospitals, but also some of the other, what we might consider now as non-traditional, considered non-traditional.
So essential workers, Yvonne, can include people that are still at work because their services are needed to support life. So that example includes the people who pick up our trash, includes the grocery store workers that are stocking shelves, includes anyone that is still providing service at this time while others are sheltering at home. And that opportunity for testing is extended not only for symptomatic essential workers, but also to those that are asymptomatic as well.
Thank you, Suzanne, for clarifying it. I think that's really important for us to understand, because typically when we think about essential workers, it's been like hospital staff or EMS, so forth. So we appreciate knowing that today. While we're at this point, Dr. Tupper from Hurley Medical Center is on the webinar with us today, and he has a couple of updates regarding testing from Hurley Medical Center. Dr. Tupper.
Yeah, so this is really great to see all the options in the community with regards to COVID-19 testing. We've really come a long way over the last 2 months with regards to the availability of testing. We continue to test our patients at the medical center and have testing widely available at the medical center for our patients that need to be admitted, for those in the emergency department, and also at our urgent cares and other clinics. We have the capability of performing tests. Our focus obviously is patients that are presenting symptomatically for care, but anyone with symptoms of COVID-19 that's presenting to one of our clinics or the emergency department that has symptoms can and will be tested. If you are a asymptomatic essential worker, I would encourage you to seek one of these testing sites that Suzanne has provided, should you desire testing. The other good news to report is that we continue to see a flattening of the curve. We are testing now more and more people. The percentage of individuals that are testing positive has been lower and lower, which not only reflects that we are testing more people, but also that the prevalence of the disease in our community continues to be flattened. So we're all the efforts that and all the work that everyone is put in with regards to staying home, keeping the community safe, Although certainly challenging, we are seeing the benefit, and the number of individuals that test positive now is essentially, we are still seeing COVID-19 in our community, but it's down to a handful per day at our institution.
Thank you, Dr. Tepper. One quick question for you while you're here, and that is that we know that we're really concerned about COVID, but people are not going to the hospital for other really emergency kinds of situations. So can you talk about that a little bit, give us an update and encouraging people?
Yeah. So I think, again, the message here is, if you are ill, we want you to seek care. And if you feel ill, we want you to seek care. And that's been a concern over the past few weeks, is we are seeing a lot of patients presenting to the emergency department that are critically ill from conditions that are not COVID-19. And so my concern is that out of the very reasonable fear of COVID-19, some people are afraid and have put off seeking medical care. But if you feel ill and you're having concerning emergent symptoms, we want you to be evaluated, and we will make every effort to keep you safe, but provide the care. What we're seeing right now is a high percentage of patients that are coming in very ill, and most of those patients, almost all of them, do not have COVID-19. But my concern is that people are having heart attacks and strokes and staying home, and then when they get to us, it could potentially be too late, or have a worse outcome because of delays. So if you feel ill, we encourage you to seek care, and also for the management of chronic medical conditions. Call your physician's office and see what options. Most physicians in the community have set up options for things like telemedicine. And so if you have chronic medical conditions, diabetes, high blood pressure, asthma, they can set up options to see you and provide long-term care for chronic medical conditions over the phone or via video conferences like this. So encourage you to interact, call your primary doctor, see what options they have for you.
Thank you, Dr. Tepper. We're going to talk about the importance of primary care homes, medical homes, in just a moment. But we have a follow-up question for Suzanne. You've already mentioned, Suzanne, about what GHS, the Genesee Health System, is doing to reach the elderly. But the question is, you can respond to this, how are Flint and Genesee County residents reaching the elderly regarding testing for COVID-19? And what is the number again for Walmart appointment?
Okay, so to remind everyone that senior citizens are in the priority testing group. So all of them, whether they're symptomatic or not, qualify to go to one of these testing locations to be tested. As you know, Genesee Health Systems is going to facilities like the assisted living homes to assist with testing. So they are doing those group testing settings. I did want to share that the Walmart number is 866-448-7719. Again, 866-448-7719.
Thank you, Suzanne. And as a reminder, we know that everybody may not be able to see the screen because they're calling by phone. So for those of you that can, we are responding to questions for those who are not able to see the slides in the webinar. So thank you for that, Suzanne. This conversation does really provide a good segue to why the testing is so important. When people are tested, there's also another thing that needs to happen as a follow-up. We're happy to have with us Kirk Smith, who is the CEO of the Greater Flint Health Coalition, working in partnership with other organizations. There's a group that's emerging called the Contact Tracing Work Group. He's going to talk to us a little bit about this group and why it's important and how might you be involved? Kirk, help us with this.
So one of the most important things in addition to testing is making sure that if individuals have symptoms, they get testing. But the other thing is making sure if you've been in contact with someone else who has tested positive, that you're aware of it so you can take the proper precautions. In public health, contact tracing is really the process of identifying persons who have come into contact with someone, in this case, who has had COVID-19, and making them aware of that. So if you test positive, what's going to happen is the local health department will provide you with information about how to keep you and your loved ones safe while you recover. The way they do that is by reaching out and calling you and talking to you about not only your symptoms and what you can do about it, but they talk to you about who you may have been in contact with. And with contact tracing, what then happens is that individuals you've been in contact with will also get a call. They will be informed about the fact that they've been exposed. They may not have symptoms yet. They may not ever have them. But what we then ask them to do is to understand not only that they've been exposed, but the risks and how they themselves can protect their own health as well as others they may come into contact with. One of the things that we've tried to ramp up locally in support of the local health department is to make sure that we have a robust team of volunteers who are available to help reach out to residents with contact tracing calls. The graphic that's on the screen comes from MDHHS specific to contact tracing, what it is. And the big takeaway is as individuals in the community get a call from MDHHS, from the county health department, one of the most important things you can do is to answer that call, to talk to individuals who are reaching out, trying to provide recommendations and share information. It's with that type of effort and working together as things like the economy and businesses start to open up, as restrictions are lifted over the weeks and months ahead. This effort, along with testing, is so important. One of the things, the last point I would make is when an individual is called with a contact tracing outreach effort, your identity is protected. The information that you share, your name, your contacts, anything of that nature, that is not something that is going to be shared beyond that call. And lastly, if you ever get a call where someone is suggesting and asking you for personal information, like a social security number, a driver's license, or a credit card information, that would never happen on a legit contact tracing call. Never feel that someone would have to give that information. One of the ways that people can help in addition to answering the call is to volunteer. And I think in next week's webinar, we can give some additional information on how to volunteer, how to complete that process, and be a part of the local working group of organizations that are encouraging more volunteers and even providing them so that we have the capacity to do this locally in the weeks and months ahead.
Thanks, Kirk. And yes, that next week we will talk more about that. So we'll look forward to you being back with us next week. So thank you so much. It really, this sets the platform again for the next part of our conversation today. Because as people are getting these calls and saying that you may have tested positive, they want to have a medical home. And so it's really important for us to understand how that can happen. So another member of the Greater Flint Health Coalition is Taylor. Taylor, would you just tell us a little bit about the opportunities for healthcare coverage enrollment and what you're doing with Medicaid coverage?
Definitely, I'd be happy to. So I serve with the Greater Flint Health Coalition on the Connecting Kids to Coverage program. And if you're not familiar with our program, what the Connecting Kids to Coverage program really does for the community is we serve all of Flint and Genesee County, and we provide one-on-one healthcare enrollment assistance for programs like Medicaid, My Child, CHIP, and Flint healthcare coverage. And so we're available to help answer questions about healthcare options, as well as assist families and individuals in completing the application in its entirety. So including the uploading of any required documents or anything their application is asking for. Our outreach enrollment coordinators are available to make sure that the application gets submitted successfully and answer any questions you may have about that coverage plan. And during the current COVID-19 crisis, our program is providing the same one-on-one application assistance via the phone. We also do have a texting and email line also for questions. If individuals want to make an appointment with us or have questions about their plan or having any issues, they can call or text us at 810-853-6458, and we're happy to walk individuals through the application or answer any questions they may have about that coverage.
Thank you, Taylor. I know one other important thing that the Health Coalition helps with, and that is the Flint Registry. And we heard Congressman Kildee encourage us last week to be sure that we're supporting the Flint Registry. So I know, Nicole, you're on. Can you just tell us quickly about the Flint Registry? And if we are supporting, what might we be able to do to support the additional funding for the Flint Registry?
Well, I think one of the best things that you can do to support the Flint Registry is actually complete the survey. So that is available online at flintregistry.org. We're really excited because through this project, we've actually pre-enrolled about 28,000 people, and we've had 10,000 people complete that survey and actually get connected to resources. And so that is really the best way to support this project, is to visit the website flintregistry.org, or you can call 833-463-5468 and just continue to support the project, enroll if it's available for you, and tell your friends the same.
Thank you, Nicole. Now, as you're listening, we have a lot of resources available in our community, and we want to make sure that we utilize those resources, and we thank our partners for making these a reality. And for you that go out and vote, this makes a difference. So one of the things we're talking about is encouraging the medical homes. We've heard about children's health coverage. I want to talk to Jim Melanowski now about the Genesee Health Plan and enrollment support for adults and those who do not have health care. Jim.
Yes, it's very important. I was listening to Dr. Tupper, and right now you might not have COVID-19, and that seems to be a big priority, but a lot of us have chronic health conditions, and we might have just lost our job. We need to get enrolled into healthcare, so they can certainly enroll with Genesee Health Plan. We can get them quickly qualified over the phone, especially if they have immediate prescription needs that we can help with, or if someone's experiencing language barriers or cultural barriers in trying to access care, we can help with that. So, really give us a call. We work very closely with the Health Coalition on Medicaid enrollment. And also there is open enrollment into the Affordable Care Act, or Obamacare too. So during this time when people have lost jobs. So a lot of times we can help with all three of those. So we can get them on the health plan right away so that they can access the doctor, they can access the prescription coverage, and then we can also get them qualified for and enrolled into the Medicaid expansion, and Obamacare if we need to as well. So it is an important time for primary care. We don't want people to go without or think about, well, I'm going to take care of that at a later point. You heard from Kyle, it's time to sign up for these assistance programs now. It's time to get enrolled, especially if you've lost your coverage. Time to do it now. Dental is another area that we can help with dental coverage. And so right now, a lot of the dental offices are closed for non-emergencies, but we can help get people enrolled into dental care that doesn't have it, so that when things do open up, you can take care of those things. You want to be healthy before the next wave comes, if that does take place, and you want to make sure you can fight off the next wave. And so we want and encourage people to have that primary care home and to get healthy.
Thank you, Jim. So we've got these projects going on, we've got work going on, our communities out there, we're getting tested, We're going to do some contact tracing. We're going to make sure we have a medical home, and we have a resident doc. We have our resident doctor with us. I want to remind you that the Q&A button is there. You've heard a lot of information today, so put in those questions so that our panelists, they can answer your questions directly. So please put your questions into the queue and put them to work. They're here to work for this next week to answer your questions. But we do have a resident physician. We call our resident physician, Dr. Susan Wolford from the University of Michigan, has been helping us with understanding some of the clinical pieces. I want to start by saying, Dr. Wolford, we had a question come up about the difference between the two nasal kinds of tests that are going on. Can you just give us some insights on this testing?
Thanks so much, Yvonne. Can you hear me?
Yes, I can now.
Okay,
Yes.
All right, awesome. Well, I thought to answer the question about testing, we might take a little bit of a recap and cover something we talked about early on in the webinar. We talked about the fact that this coronavirus is this tiny particle, and importantly, in the center, it has this genetic material, right? It's not the double-stranded DNA that we normally think about when we think about genetics. It's just one strand, and that's important when we come to the testing. We know that what the virus does is it gets into cells and then it replicates and sort of hijacks them. And if you want to hear more about or learn more about that, you can look back at one of our earlier webinars. But for this particular coronavirus, it's very good at attaching to cells in the respiratory tract and in the lungs. So that is also important to where we test and how we test. There are two types of tests that people think about, and we mentioned one earlier in this webinar, that if you're recovering from the test, then there are blood tests that are being developed that can look for antibodies, and we'll talk about that at another time. But this issue of the sampling is to do with the test that can tell you whether you have coronavirus right now, whether or not you have symptoms. And so, as we all know by now, that the way that we've been doing this is by getting that nasal swab. And we've been going right back into the nasopharyngeal area and getting the sample from back there. It's then transported to the lab, where it's important to note that what happens is really like a recipe. You add the components that we think we need, you do it at the right temperatures and at the right time, you follow the recipe, and if your recipe works, you end up with what you wanted. So the recipe here for finding out whether you have coronavirus is one that causes us to add a reagent that will get that genetic material out of the cell that we spoke about, and then it will add another ingredient that will change that into the double-stranded DNA that I spoke about. Next step, we add another reagent and heat and cool it many times to make lots and lots of copies of that DNA so that we have enough that when we test finally, we'll be able to say, aha, it lights up, this is coronavirus that we're looking for. Now, how have the tests, and we know that we have a positive test, how have the tests changed? So in many ways, because we had a shortage of many things, we had a shortage of the swabs, we had a shortage of the reagents, we had a shortage of people with protective equipment to be able to do the swabs. Many people have tried to think about different ways to address this. So if we could get enough of a sample nearer the front of the nose, so one, people won't be afraid to do it. Two, they won't sneeze as much and get it on everybody. Three, it's easier to do so that you won't have to have people with PPE to protect them, to collect the sample. All of those things are things that people have looked at, and so have created new swabs so that you can collect the sample from the anterior part of the nose or midway along the nose without having to go all the way back. Also, even the material that the swab is made out of has been changed. So we've now allowed, the FDA has said we can use polyester swabs as well as nylon swabs that we were using before, so we can have more of them available so more testing can be done. Another thing that's been done is we used to transport it to the lab. Well, that took time. Now there are kits And that is why people can do more of these tests in more areas. So you can do them in Walmart, you can do them in Walgreens. You don't have to send them to one central lab. That cuts down on a lot of time. We also have changed the material in which it can be transported. So previously it had to be transported in a particular reagent. Now we say maybe it's okay to transport it in saline, salt water, and maybe that will work just as well. And then the other change I want to mention is that if you remember, I said when we needed to make this into lots of copies of that DNA, we used to do the heating and cooling, add the reagent and do a heating and cooling procedure that took a long time. Now we say, well, maybe we can do this without that and do a different procedure that will multiply it in more of a printing way rather than needing the heating and cooling, and still be able to test and know that you have a positive result. The question is, how good is our recipe? Do we really come out with the answers that we need? And there's some question about that. Because all of this has had to happen very quickly, a lot of the validation tests that we want to have, we can't do as many of those. And that's why you will hear in the news that people will say, oh, there's a new test that's very quick, but it seems to be missing some of the positives. So I think where we've landed at this moment, and this is just going to change rapidly, it's going to continue changing, where we are at the moment, if you get a positive test, you can be fairly sure you have coronavirus. If you have a negative test, you might wonder, and if your symptoms are suggestive of coronavirus, then many physicians would just go ahead and treat you as if you had it and possibly repeat the test. I know that was a long answer to a short question, but I hope that helped to fill in some of the gaps.
That was a lot. So we're going to ask you to stay tuned because I know there are more questions. I was getting to understand that some of us, our folks that are watching by YouTube, can't put their questions in. So we're going to ask you if you just could go online. You're going to get and send an email to us at the website we'll give you later if you have some questions. So thank you, Dr. Wolford. I have a quick update from the City of Flint. And then we're going to hear from Dr. Deborah Verholden. Dr. Reynolds was just going to tell us what he said. He had one thing to share today.
Well, now it's two. I will defer to to my colleague, Chief of Staff Brian Larkin, to give you an update. And I will just say that the curfew in the city of Flint has been extended through May 28th. 11:59 p.m. And Mr. Larkin can take over.
Okay, Mr. Larkin, we got about 1 minute.
I'll use that. And thank you, Dr. Reynolds. I'm gonna tell my mother you called me a doctor today. So the mayor is putting together has put together a blue ribbon committee that's gonna come out with distinct recommendations for tasks and what it looks like for reopening the city. And so these are things that everyday residents can understand and get behind, kind of how can we congregate in spaces? How can we use our public parks and spaces as well? How can we access resources? What are things going to look like? And so expect results to be coming out from there really soon. And we're studying now what it looks like across the country for best practices for opening City Hall, trying to do some upgrades, provide the PPE equipment, change routing, and change some of our activities. So be on the lookout for those, and we'll regularly communicate in this group as those things are happening.
Wow, Brian, you did it. Thank you. But we know that there's more to come, so we want to invite you to come back and tell us more about what's happening with the Blue Ribbon committee that the mayor has put together. I know it's going to be important information for us. We were going to have a presentation today from Dr. Deborah Verholden. She's going to be back with us next week and talk a little bit about some of the things that are happening with the task forces that are coming up. So Dr. Deborah, we thank you for being available to us when we need you. We have a brief updates from our community partners. We know that MTA, as an example, has had some changes that have been coming forward with the mass transportation. They wanted us to let you know today there is a new process that will begin next week, and they will have more details for us next Friday during the webinar so we can have a better understanding of how to access the services through our Mass Transit Authority. Our school system, our City of Flint school system wants us to remember that meals are still being available for our community school system. This is the Flint Community Schools. They are still providing the grab-and-go breakfast and lunch distribution as they do every summer. They provide this, and they want you to know, families, please encourage the families to utilize this, because they're also sharing information about what the students should do in preparation for the upcoming school year and during the balance of this school year. As we prepare to close out today, we want to remind you that we will be back here next week. You can subscribe to our YouTube channel, Healthy Flint. Please help us to keep the word going. Because of you, we'll be here again next week. Send us any questions at healthyflint.org. That would be helpful for us, so stay connected with us. We will be back next week. We already know that Metro Community Development will be sharing with us. We'll hear more about our contact tracing committee. That's a community county committee. One of the things we want to make sure is we're taking care of our community. I want to thank you all so much for joining us again today. For all of our presenters and panelists, the information you shared has been absolutely invaluable. And trust me, people are saying how they are utilizing the information every day to make a difference in our community. So again, please remember to fill out the webinar evaluation at the end so that we'll know exactly how to support you. There were some questions that came in, so I'm going to ask our panelists to stay on and answer those questions. I'm going to have to give you one verbally because it's from someone who's not able to actually be on live. But we want to thank you again for being with us, and we will see you again next week.